Welcome to Dr. Gong's talk on sleep science, representing worldsleep.com and medicine.net. The theme is sleep science, disorders, and management, a popular science education and comprehensive guide to sleep science, disorders, and evidence-based strategies for achieving restorative, high-quality sleep. I have two parts for today's talk. Part one is sleep science and health. Let's have some basic concepts. Sleep science is a combined sleep field integrating psychology, medicine, and neuroscience. And sleep health focuses on sleep quality and the absence of sleep disorders. And sleep neuroscience focuses on the neural and physiological mechanisms and functions of sleep. The essential points here, sleep represents a vital physiological function and self-regulatory protective mechanism for the brain and the neural cells at all levels. An adequate, high-quality sleep is essential for supporting overall human physiological and psychological functions and health. Persistent sleep disturbances and deprivation can lead to catastrophic consequences, ultimately resulting in death in both humans and animals. The Barthel Health Index, it is used for activities of daily living evaluation of a patient or subject, including four main categories: diet, emotional state, exercise, and sleep. And it's basically to reflect the functional recovery and the capacity of any individual. Statistical data indicates that when diet, emotional state, exercise, and sleep patterns improve, the Barthel Index significantly increases, and this is accompanied by a marked reduction in the risk of major cardiovascular diseases and a significant extension of lifespan. So we know diet for its food safety, nutritional quality, and eating patterns influencing health outcomes. And emotional state, the psychological well-being is key to daily health. And the physical activities on regular basis can greatly improve your Barthel Index scores. And sleep patterns, especially quality sleep, is a fundamental pillar of daily health. Now let's go into the physiological hazards of sleep disturbances. Sleep disruption triggers include daily disruptions and psychological conflicts, excessive mental stress, and overexertion. This will cause sleep-wake disorders and making changes in the hunger hormones like ghrelin, orexin increase, and satiety hormones leptin decrease, and stress hormone cortisol increase. And this will cause fat accumulation and insulin resistance, and gradually leading to chronic diseases such as obesity, diabetes, hypertension, hyperlipidemia, sleep-related breathing disorders, etc. Now let's see the neuroregulation of sleep. These two pictures will help you see the brief anatomy of the brain and the neurotransmitters changes in the mechanism. The sleep-wake cycle is coordinated by multiple neural nuclei or clusters, and primarily including the cerebral cortex, the thalamus, hypothalamus, medulla oblongata, and the reticular activating system in the brainstem. And these structures work in concert to balance the transitions between wakefulness and sleep. You can see these pictures as a brief understanding of neuroscience. And the one on the right just indicated the wakefulness factors by orexin and ghrelin from the hypothalamus, together with serotonin during the day, and dopamine rewarding to make the wakefulness. And the norepinephrine is mainly for alertness. And this is just a summary of the neurotransmitters. As we can see, the main wakefulness neurotransmitters are orexin, ghrelin, and together with serotonin during the day. And serotonin has a dual role. So during the night, it will turn into melatonin and promote sleep, together with inhibitory and neurotransmitter GABA. So this is basically repeating the changes of the neurotransmitters during the wakefulness: orexin, serotonin, dopamine, and ghrelin, and then glutamate. And during sleep, with high levels of GABA and serotonin, melatonin. Let's see now the circadian rhythm of sleep. The human sleep-wake cycle is dominated by an internal biological clock, while being regulated by environmental factors such as light and temperature. Disorders of the biological clock can trigger circadian rhythm sleep disorders, commonly with three types: jet lag disorder, as we can see in the international flight, and the shift work sleep disorder, and delayed sleep-wake phase disorder. Let's see the definition and the standards of effective sleep. And the normal effective sleep is evaluated by the sleep efficiency, the sleep time divided by time in bed, times 100%. So usually it's more than 85%. Over 90% is excellency. And the minimum sleep hours is usually 6 hours. Some people 5 hours. Depends. And the effective sleep requires circling through both rapid eye movement, REM, and the non-REM sleep stages. And effective sleep is essential to promote physical recovery, cognitive function, emotional stability, immunity, maintenance, and overall well-being. And the sleep cycle is usually divided into 4 phases. The first is N1 light and Second is N2, moderate sleep. And third is N3, deep sleep. And then it is REM, rapid eye movement sleep. So every person regularly experience 90 to 100%, 120 minutes of a single cycle, and with 4 to 5 cycles a night. And why the deep sleep matters is because although it's short in the duration, non-REM, it is irreplaceable in energy restoration, memory restoration, consolidation, and physical replenishment, and immunity enhancement. So frequent disruption of the deep sleep can lead to brain dysfunction. And rapid eye movement sleep with the characters of rapid low frequency brainwave, rapid eye movements, and accelerated heart rate, elevated blood pressure, skeletal muscle atonia, and genital engorgement, and accompanied by vivid dreaming. And the dream during REM is different from non-REM. In REM, dreams are usually detailed and vivid and easier to recall after awakening. While non-REM dreams is usually in a deep sleep, so it's mundane and hard to remember. And dreaming as a function or functions are complicated and inherited physiological function of the brain. It is not meaningless. Some are meaningless, some are with rich meanings and mysteries yet to discover in future. The physiological process of wakefulness. The wakefulness is a synthesis of physiological and cognitive processes. The physiological basis for human interaction with the external environment causing the result of wakefulness. And with the current more mature understanding, wakefulness is not only by the traditional ascending reticular activating system, but also including the various parts, neuronal clusters or nuclei activating the cerebral cortex and the thalamus cortex loops to induce wakefulness. And without the external stimuli, this loop will keep in slow wave status of non-REM sleep, and the external stimuli are necessary to trigger the wakefulness. Now let's see the factors affecting sleep and the management strategies. This is basically sleep health. Number 1, environmental factors. Noise, light, temperature, and humidity all impact sleep quality. And the strategy is to use noise-canceling earplugs, blackout eye masks, soothing music, and temperature humidity control devices. Second point is lifestyle habits. Irregular schedules and the lack of exercise affect sleep quality. And the strategy is to maintain a regular schedule synchronized with your biological clock and engage in moderate, regular physical exercise. This is always helpful. Third, dietary habits. overeating, ingesting chocolate, tea, coffee, alcohol, etc., exciting substances before bed, lower sleep quality. So the strategy is to follow a light diet, avoid these foods before bedtime. And the last is the thermoregulation. And we understand that the core body temperature, the internal organs temperature, is usually 2 degrees higher than the peripheral limb temperature during wakefulness. So to promote sleep, the strategy is using hot bath and food soak before bedtime to narrow this gap. And this is actually aligned with a standard method for ultimate sound sleep. Now let's go to part 2 of this theme, sleep disorders. Sleep disorders in clinic is called sleep-wake disorders. It's a group of diseases characterized by abnormal sleep duration or abnormal behaviors during sleep. Prevalence in adults is as high as 30%, and the treatment should emphasize comprehensive management, addressing both symptom relief and the causes while trying to avoid drug dependence. Let's see the international classification of sleep disorders. First is insomnia. Second, circadian rhythm sleep-wake disorders. Third, sleep-related breathing disorders. Fourth, central disorders of hypersomnolence. Fifth, narcolepsy and hypersomnia. 6, parasomnias. And 7, sleep-related movement disorders. Generally, the first two, insomnia and circadian rhythm disorders, are considered as functional sleep disorders. It can be improved through standardized intervention and management. And other types are mostly pathological and requires a specialist diagnosis and treatment. Let's first see the insomnia, most common one. The main manifestation of insomnia is difficulty falling asleep and maintaining sleep, frequent awakenings, excessive dreaming, early morning awakenings, daytime fatigue, reduced attention, and irritability. If a person with these symptoms is by your side, you can easily judge it. The possible mechanism is hyperarousal theory. It's the ascending reticular system overactivating, and hypothalamus, prefrontal cortex in high hyperexcitatory status, and elevated ACTH, corticosteroids, that's interleukin 6, TNF alpha, etc., and decrease melatonin, which helps sleep. The diagnostic guide should follow these standards. Symptoms should occur more than 3 times a week and persist for 1 month. So to diagnose insomnia or consider, because you can just judge it as insomnia as it happened once or twice. Overall prevalence exceeds 30% in adults, as we talked before. And the treatment guide with two lines. The first is CBT, which means cognitive behavioral therapy, category 1, and cognitive restructuring and sleep hygiene education is important, and fixed bedtime and limiting daytime naps to 1 hour to avoid oversleeping during the day, and avoid electronics, stimulants, and alcohol before bed. Relaxation training and deep breathing, meditation, mindful calming practice. This all helps. The second line of treatment is short-term medication. And suvorexant is usually the number one choice. Is orexin receptor antagonist, and the zolpidem is also frequently used. And the benzodiazepines is basically to relieve anxieties, etc. And diphenhydramine is allergy thing. It helps, but with more side effects. So the course of medication should be less than 2-3 weeks to avoid or prevent drug dependence. And all medications have side effects, so they require physician's consultation. The second common disorder, circadian rhythm sleep-wake disorders, with the characters or features of disalignment between the individual's desired sleep-wake schedule and their internal biological clock. With the three common types, let's see, jet lag disorder. In most cases, this disorder resolves spontaneously within 4 to 6 days without special treatment or intervention. And the second, shift work sleep disorder with nocturnal light therapy. It helps improve sleep-wake rhythm disturbances for shift workers. But the best recovery method is to recover your normal schedules. The third, delayed sleep-wake phase disorder, by taking melatonin 30 minutes before bed will help you sleep faster, and it helps regulate your biological clock also. The last disorder, or actually a symptom, pretty much snoring, as a common clinical phenomena or symptom. It's not a really disorder. It's just a phenomena, and it's categorized into physiological, example due to airway over relaxation of muscles, and pathological types. The incidence increases with age. The management depends on the nature of snoring. If the snoring is frequent and severe, you should consult a specialist promptly, because it may be a breathing-related sleep disorder, and it can cause sleep breath to stop. And regular physical exercise and compliant sleep health products can effectively alleviate the physiological snoring symptoms. summary, market opportunities in sleep health. Although insomnia prevalence is high, it can be effectively improved through scientific standardized intervention, and this has driven market development of the sleep aids, sleep health products, and nutritional supplements. Consumers should keep wary of false advertising and fraud. The second aspect is consumer preference shift. And natural, non-chemical sleep aids and nutritional supplements have become the preferred direction for consumers seeking safer, sustainable solutions rather than prescribed drugs. The third aspect is the e-commerce is a main channel for sleep health products, presenting huge potentials in this emerging market. So the expansion of the global middle class is also a core driver for the market in demand. Thank you very much for coming to the last page, and here we recommend our major resources: worldsleep.com, worldmedicine.com, and to you with a lot of helpful information and professional knowledge for general health, clinical purpose, and sleep health. Thank you, and may you have great sleep improvement.